recognize that being in a hospital takes people out of their normal roles and daily lives. We know that having a loved one in the ICU is stressful and upsetting, but rest assured at Rush, we value patient and family-centered care. Families have told us that it is important and helpful to understand that safety procedures will always be a priority in patient care. This video will explain some of the ways we work to make sure that our patients, staff, and visitors are safe.
Each visitor needs a guest pass obtained from the 4th floor information desk. After receiving a guest pass, check in with ICU guest relations when you exit the elevator. Here you will receive an ICU identification lanyard. If it is after 8 p.m., please return the lanyard to the box before you leave the unit. There are 2 visitors allowed in the room at one time. Rush security is present throughout the Rush campus and at the ICU entrances. They are here for your safety. To prevent infections, we do not permit anyone under the age of 12 on the unit. If you're feeling sick, have a sore throat, fever, or cold, please reschedule your visit when you feel well. Some patients may not be allowed to receive flowers. Check first with your nurse. Before giving the patient anything to eat or drink, please check with the nurse.
Wait, Mom. It says that he's NPO. The nurse said that this means he can't have anything to eat or drink yet.
Okay, let's call the nurse and find out.
Our goal is to have a quiet, healing environment for our patients. You should either be in the room or visitor lounge to protect the privacy of all our patients. Please keep the visitor's lounge and the patient's room calm and quiet. Rest is critical to healing, so please be mindful of your patient's need to rest when you visit. If a patient is sleeping, please allow them to continue sleeping and wait for them to wake up. This may also be an opportunity for you to get some rest. All personal and business calls should be taken in the visitor lounge.
Yeah, I'm sorry, I couldn't talk in the room.
One visitor, age 18 and over, may be allowed to sleep overnight in the room. However, we recommend that unless it is completely necessary, visitors sleep at home, so they can also be well rested in making critical decisions. We realize that this is a stressful time for families and friends. While on the ICU, it is important to be present and focus on the wellness of the patient. Speak to a staff member about resources to assist you in dealing with difficult situations. We encourage you to ask questions. If you have any unmet needs, please inform us right away so we can help you. Rush protects the basic rights of each patient by upholding policies and procedures. Procedures related to safety include being asked to temporarily leave the room during certain interventions, respecting a quiet, no talking, no question zone while a nurse or doctor is providing care that requires their undivided, focused attention and concentration, and partnering with the bedside nurse to identify appropriate times for information updates. You may want to develop a phone tree to make updates efficient. We recommend you set up a password so you can obtain updates on your loved one's status over the phone. Patients have the right to visitors as long as the visitor's presence does not infringe on the health and safety of the patient or the rights and safety of others, including staff. Should you ever find yourself concerned or worried, or have questions about your loved one, please ask the bedside nurse, charge nurse, or manager for assistance as soon as possible. We have many resources that can be used to respond to your needs for information and support. Visitors should conduct themselves in a manner that is therapeutic for their loved one. Our goal is to work together to give the best treatment possible. Our hospital upholds eye care core values: innovation, collaboration, accountability, respect, and excellence. And we invite you to partner with us to ensure everyone demonstrates these values during your stay.
These guidelines are intended to maximize the benefit of patient visitation, honor all patients' privacy, and finally, to support the safety between staff and visitors at Rush. We look forward to partnering with you to provide the best care possible.